It is just a huge honor for me today to be podcast interviewing Dr. Christian R. Kenworthy, DDS, MS. He attended Brigham Young University for his undergraduate education. He received his BDS and DDS degrees from the University of California, San Francisco, and his orthodontic certificate and a master's degree from Mayo Graduate School of Medicine. His writings have been published in the Journal of Orofacial Pain, the Journal of Prosthetic Dentistry, the European Journal of Orthodontics, and the American Journal of Orthodontics and Dentofacial Orthopedics. He's an active member of the American Association of Orthodontists, completing his term as president of the Rocky Mountain Society of Orthodontists in 2016. He has not had impression trays or alginate in his office since 2014. This has allowed him to become more accurate and efficient in the delivery of custom orthodontic solutions. He is immersed in digital orthodontics and enjoys sharing the solutions he has found. Dr. Kenworthy's Missoula, Montana practice supports all the fun. He and his wife and their 5 boys. I have 4 boys. He beat me by 20%. Dr. Christian Kenworthy has published poetry, coached semi-professional baseball, written a few novels, and led Boy Scout troops. He and his wife and their 5 boys enjoy fishing, hiking, 4-wheeling, camping, skiing, and other outdoor activity that Western Montana has to offer. By the way, to the international viewers, I live about 1,000 miles straight south of them, and everybody in Arizona tries to figure out how can I be in Arizona in the winter and Montana or Canada or Alaska in the summer. I think the area where you live is the most beautiful. I don't want to start anything negative, but this is Dentistry Uncensored, and in the news today, 3 orthodontists have sued. They launched a lawsuit in Nashville against Smiles Direct Club. And there's, I don't want to bring an orthodontist on the show without at least starting that, because it went public this month. A couple of things went public this month. Danaher spun off their dental division. And I think that's really cool, because when I got out of school 30 years ago, Siemens, which is the largest company in Europe, kind of like a Procter & Gamble, Johnson & Johnson, the CEO decided they were too overweighted in healthcare, so they spun off Sirona. And the building didn't change, the people didn't change, but the parents that didn't want them were gone, and they just blossomed for 30 years. And I'm sitting here thinking, my God, Danaher owns some of the greatest dental companies in the world, and their parents didn't want them. You got 5 boys; they'd all run away from home tonight if they thought you didn't love them or want them. So Danaher spun that off. That went public, but Smiles Direct Club went public, and it's the most controversial thing in your profession that you've probably ever seen. Have you ever seen anything more controversial than that?
No, it's crazy, actually. So I probably get asked, and probably every orthodontist does, I get asked, I bet 3 times a day on average, where somebody says, hey, what do you think of that do-it-yourself aligner thing? Is that going to work? Like, people are seeing it. Their advertising dollars are working. And it's getting people thinking about it. But I think a lot of people are skeptical. And the problem is, at least what I tell patients is, you know what? I wouldn't move somebody's teeth without looking at an x-ray. I wouldn't move somebody's teeth without checking their gums out. I wouldn't move somebody's teeth without knowing where their bite is and knowing what they really want. And all those things are really hard to determine from a self-made alginate impression. So anyway, I actually do aligners in my office, and I charge $200 a tray. And so for pretty much what, the $2,000 or $3,000 that Smile Direct Club is charging, I can do a pretty dang good job for about that same fee. And people just don't know, what they think is Invisalign costs $6,500 and this costs $2,000 or $3,000. I'm going to do and they think it's the same thing. It's all just aligners, right? So they just think it's the same thing. So I think with a little education, people will make the right choice most of the time.
So, well, you must, so you're saying Invisalign usually costs $6,500 and Smiles Direct Club, what would you say that usually cost?
I think they advertise that they'll do things for about $2,000, but when I've talked to patients, they say that it ends up costing more than that. So there must be some other fees for something else. I don't know. I've never used it. but I think their advertising says they're about half of what Invisalign costs at the orthodontist.
So is there actually Invisalign shops in Montana?
There's no Invisalign shops. Like there's no offices where you can go get scanned directly for Invisalign and they'll send you to an orthodontist. There are plenty of orthodontists who are doing Invisalign and plenty of dentists who are doing Invisalign, but there isn't a standalone Invisalign shop.
Okay, so Smiles Direct Club, you seem high tech. But by the way, people, last night I thought I'm going to go prepare for my interview with Christian Kenworthy, and you have written for OrthoTown, and I knew you were all that in a bag of chips. My God, if you Google this guy's name, he's associated with. You are so high tech, all this stuff. But before I get in the high tech, they're filing that lawsuit today. So do you think that's where this is gonna? Do you think this is where it's gonna end up? That this is something that's is it gonna be pure and clean competition, or is it gonna be no? This is just needs to be shut down in courts. How do you see that?
I think the biggest problem is they don't use a dentist, and so they are. Unless they've got somebody that's licensed in Montana, they're not practicing with a license. I bet that's what the legal action is. And the problem for patients with that is they don't have any place to turn for recourse. If something's happening wrong, they have to email back to this company. They get another box of alginate that they can goop themselves up with, and somebody else, but nobody's ever talked to them. They can't go to somebody's office and say, hey, this is bugging me. This doesn't feel right. And so I think it's the practicing outside of the Dental Practice Acts that's the problem. But I don't mind competing with them. I don't mind competing with anybody. You can move to Montana. I'll compete with you, punk. Come on up.
Way, you got one more boy than I do. 5 boys against 4. I'm not, so basically what he's talking about is, this is the case. So it's 3 orthodontists. Their names are, Dr. Joseph Sisio, Dr. Vishnu Raj, and Dr. Arthur Capet. And they launched a lawsuit because, let me read this legally right. Patient, Dina, is a resident of Michigan who purchased aligners from Smiles Direct based on defendant's written representation. Smile Direct developed a plan of treatment to correct, among other things, snaggletooth, and represented that her snaggletooth would be corrective. However, Smile Direct's aligners, in fact, worsened the snaggletooth, did not correct its placement, and caused the snaggletooth to become loose and sensitive. So basically what you're saying is, when there's not an orthodontist there, it's a teledentistry model. So is this a teledentistry technology? You're as high tech as they come. Where is teledentistry work, and where do you see it not working in your profession of orthodontics?
So this is a great teledentistry model. So I have patients who leave Montana to go to college, want braces done, we'll work them up, figure out a treatment plan, build them aligners, and send them with aligners. And there's a great product called dental monitoring that will let them download pictures into an app through their iPhone, and it will update your scan. So it will measure how much the teeth are moving. So there are great. Who
makes that dental monitoring?
They were their own company. When I bought them, they're actually out of Paris. So for a while, I moved my family to Paris and had them living in Paris for about 3 years. And
are you serious?
I'm serious.
How
you on live TV? Come on, bro.
How long ago was that? Because you got 5 boys. Were they all like under the age of 6 or?
No, so my youngest right now is 16. I'm old. So this was between 2011 and 2014-ish, or 2012 and 2015, right in there. So my oldest was maybe a sophomore, junior in high school age. Youngest was probably 10. And it was fun. Anyway, dental monitoring, that's an aside. Dental monitoring is, it was a French company. They're based out of Paris. I think it's Rocky Mountain Orthodontics who sells that product right now, is who represents them in the US. But you can get, if you go to the dental monitoring website, you can see what they do. And so they have some little calibrated lip stretchers, basically, that your patient takes a video of themselves with their iPhone. And that data, there's enough points on those teeth that when you take a 3D scan, you submit that scan to dental monitoring. And they'll actually show you how those teeth are moving. So they'll measure torque, they'll measure tip differences, they'll measure bodily movements. So you can monitor how your case is going without online. They just send you a report. You can look at the graph, you can look at their actual teeth, you can check hygiene. So, I mean, I have patients who have left here and were treated by me for at least a portion of their treatment in New Jersey, California, Texas, anywhere where there's a college, basically. So I think this model for teledentistry is great. The difference is the plan was agreed upon with me in their office. Like, we looked at the x-rays, we decided what we were going to do. They were able to see how I was going to move their teeth. And the only part of the plan that was taken place outside of my office was actually inserting the retainers, the aligners every 2 weeks. And then I would monitor them every month to every 6 weeks to check progress. And if we needed an adjustment, I had their scan at my office. I would just make the adjustments at my office. So I think this is a great teledentistry model. It makes it super convenient for patients. In fact, the reason they developed that in Paris is because traffic in Paris sucks. And the number of orthodontists per capita is low. And so they developed this purely for convenience. But it was so accurate. Like, there were so many things I learned about orthodontics from monitoring my cases digitally that it really helped my practice become more efficient.
Wow. And now, remember, 25% of our listeners are still in dental school, and the rest are all under 30. I know that sounds silly, but what is the difference between Smiles Direct Club treatment and Invisalign? You kind of alluded earlier that Invisalign was one product, 6,500. Smiles Direct Line is less. Well, how would you explain that to a young kid?
So the actual product, like what you're holding in your hand, is probably the same. They're just clear aligners. The difference is in the diagnosis. So that's the biggest differences in diagnosis, because the treatment, so there's probably 15 or 20 different aligner companies, and then there's software that you can use to make your own aligners. So the difference between the companies is they all have their own kind of proprietary software that they have told how to move teeth. We're going to move teeth 2 degrees of torque each tray, 0.2 of a millimeter of bodily movement, whatever the dimensions are that they're going to move, that's what they choose to move them. And so if you buy an Invisalign product, the number of trays to get from that person that had the snaggle tooth to the person that doesn't have the snaggle tooth, that number of trays will be different than for Smile Direct Club than it will be if I do it myself, than you will if you do it with Clear Correct or Clarity Aligners or whatever. And that's because the software programs are all different. But the actual product that the patient has that they put in their mouth, they're going to think is the same. It's going to be a clear, suck down, vacuum formed tray that kind of looks like their teeth, that's going to feel tight when they put it in. So it's really difficult for patients to see the difference between, why am I paying $2,500 or $3,000 for one and $6,000 or $7,000 for the other? It doesn't make sense to them. And that's why this Smile Direct Club, and there are others. Smile Direct Club is the biggest do-it-yourself aligner company, but there's probably 10 of those too. And that's why they've got this in, right? They're selling it. It's cheap, and people don't understand. They're looking at the product. They're thinking, well, why would I buy a Toyota from Invisalign for $6,000 when I can get a Toyota from Smile Direct for $2,000? They think it's the same product, and it isn't. It just looks the same.
But the tray itself is a lot of technology. I know there's Dr. Ray Stewart, the founder of Bay Materials, who has his Zendura Dental I mean, so the resin is really evolving quickly, isn't it?
There are a lot of different trays, and their modulus of elasticity and plasticity are all different, but they're all kind of in the same ballpark. So even if you took the crappiest, stiffest, cheapest tray material and the most expensive high-tech tray material, and you put those in two different people and had them go through a series, their teeth would be similar at the end. It's not going to be as comfortable for one as it is for the other, but the finish is going to be similar. And so that's why I say, if you hold a Smile Direct Club tray and an Invisalign tray, you aren't going to be able to tell the difference as a consumer, or even as a dentist. If you're just holding the trays, you have to know something in the background to know that there's a difference in those trays.
Well, I used to remember, go back 10 years ago.
Yeah.
When dentists, when orthodontists would start really complaining about Invisalign, I'd always say, well, quit using them. Oh, I love their resin. So
they love the marketing. That's what they love. They market for their practice, right?
They love the marketing.
Yeah, that's why Invisalign becomes addictive for people. So, I mean, if I ask you, or if we ask your listeners, name me 3 aligner companies, Invisalign will always be one of them. Right? And if you go to the internet and type in aligners, Invisalign is going to be, if it's not the top, it's because Smile Direct is the top. But they're both putting so much money into marketing that that's the name you associate. And so if you say, I want aligners, and you Google, I want aligners, who can give me aligners? Invisalign will, because they're marketing, they'll push people to practices that are doing more Invisalign. And so you become addicted to that marketing because you get this patient flow. The truth of the matter is it has increased orthodontic awareness for the whole kind of population. And so I'll get, on my days that I see new patients, I'll probably get 30% of them will say, well, am I a candidate for Invisalign? And because I don't use Invisalign, I tell them, you're a candidate for aligners, and I just explain I use these aligners instead of Invisalign, and nobody cares. Like no patient cares, but Invisalign does a great job of advertising for all of us, really.
And what they'll do is they'll advertise till they lose it, because once the Supreme Court's clear on this, I mean, once the word becomes a verb, it's gone. Like when you start saying, go Xerox this for me, and she walked over to a Canon printer, you lose your deal. Right now, everybody in your practice says, hand me a Kleenex, and you hand them a tissue. So if it becomes, just like when you travel the world, 220 countries, a third of them, the word for toothpaste is Colgate. There is no toothpaste. So mama says, just go put some Colgate on that. It could be one of a million brands. My favorite toothpaste factory is in Philadelphia, Pennsylvania. I was lecturing there, and some guy says, you're going to have a tree. I got this lined up for you. Anyway, it's a company that had the same toothpaste, same container, but they private labeled it for like several thousand different countries and languages, and it was just amazing watching that. So Invisalign, they got to be careful. If someone says you need to get Invisalign and they can't distinguish. So basically, explain to the kids. So basically, the patents are gone. That's why you're having this plethora of this Cambrian explosion of clear aligner companies. Yeah,
that's true. The other thing that is changing this is a lot of dentists are getting printers. So the reason I don't use Invisalign is because I print my own. And the printer technology is getting so fast and so accessible that it almost doesn't make sense. The money doesn't make sense for a dentist, for an orthodontist anyway. So a dentist still might make sense because they're not really familiar with how to move teeth. And so using Invisalign's software and their staff to move teeth would still help a dentist. But for an orthodontist who knows how to move teeth, it's pretty easy to use software to move teeth. And it's relatively cheap to print them at your office, significantly cheaper than what you can buy a case for from Invisalign. And so I was actually lecturing and an Invisalign rep. They don't like me very much, but they came up and talked to me. And that's what they said their biggest competition right now isn't from these other companies as much as it is from dentists who are able to do it themselves.
And so you're a fan of the Park Dental Research. You're using Park Dental, right? You're for a 3D printer, the Jewel, from Oklahoma of all places. So why do you like that one?
So I like it because it is fast, it's accurate, and it's basically like an F-350. Like the thing just works. So I've had others that are more finicky, have to be calibrated more often, and all of that stuff kind of slows you down. So I print the Jewel 2 will print 6 models at a time. So I have 2 of them. So I can print 12 models in half an hour with these 2 printers. So if somebody wants, if I have a patient today that got their braces off at 10 o'clock in the morning, I send them to go get lunch and they come back after lunch and they have retainers. Or if somebody comes to my office for a new patient exam and we determine that aligners are a good fit for them, they can pick their first aligner up tomorrow. They're not waiting for a company to produce these aligners. We send it to the printer. I'll actually send it to the printer from my new patient exam, and they'll have aligners tomorrow. So I like them because they're reliable. The build plate is big enough that you can get, the build plate's like the size of a laptop basically, and so that's its footprint. It's probably, I don't know, 3.5 feet tall. So you have to have some room in your lab, but they're fast. The other small ones are slow. So they're really accurate. They'll print to 50 micron accuracy, but they'll take 8 hours to print a dental model. And so they're great for dentists. Like this Jewel is great for a dentist too, but it's really built, it's more designed for the orthodontic office in mind. Some places printing a lot of models. There are cheaper printers, and they're great for dental applications, where you've only got if you're going to take 5 impressions a day, using one of those other printers would be fine. You just have to be willing to wait. Like I didn't want to change my practice efficiency from alginate and fast set stone when I bought printers. And so my printers had to match or beat what I was already doing. And these do that.
So, I there's so many things flying through my head. So let's go back to Invisalign. Joe Rogan, the CEO, there was a controversial thing where he's selling Invisalign. Align Technology also owns iTero. Yeah. And so he kind of just wanted to make it so you had to use his iTero scanner and not other scanners. Was that a good move for him in your mind?
I think that sent a lot of people away from Invisalign. There was a lot of guys. I mean, scanners are a $30,000 to $50,000 investment. So if you had a scanner that you liked in your office and it was working, and a company said, you can't use our product unless you buy another scanner, so the entry fee now is an extra $30,000 to $40,000. There's a lot of guys that just kind of flipped them off and said, never mind, I'll find something else. I think that actually helped some of these other companies grow, because they just kind of were like, I'm not paying an extra 40 grand so that I can tell people I use Invisalign. And I think they've changed that. I think Invisalign will take other scans now. Like I said, I don't use them, but I have heard from guys that I think they kind of changed their mind.
Yeah. Man, it's just, they're just so aggressive. I don't know if it's my Kansas upbringing or what, but I just always see people doing things and like, it just like blows my mind how they do it. So you're, when you see general dentists doing Invisalign in Montana, when an endodontist sees a general dentist doing a molar endo, when an oral surgeon sees a general dentist taking out wisdom teeth, what are you thinking when you see your general dentist, family physician colleagues doing Invisalign?
So I don't actually mind general dentists doing Invisalign. And the reason is there are some cases that Invisalign can't treat. A general dentist who's doing Invisalign is a general dentist who is looking for orthodontic needs, right? Where some of them don't, because it's just not the focus of their practice. So if Invisalign becomes part of your practice as a general dentist, you're going to start seeing things that could be improved with orthodontics more than somebody that's not looking for that. And there's enough cases out there that if the general dentist is doing the easy ones and he's sending me the hard ones, I'm fine with that. The real thing I think that happens is at a certain point, you're going to get a case that you're going to do with Invisalign that's not going to turn out. And somebody's going to have to fix it. And so I'm happy to fix Invisalign cases from general dentists, and I generally don't charge for them because it helps me teach the dentist like what the limits are of that technology versus braces, traditional braces. And so I don't mind it. That's my short answer.
Do you think Joe Rogan is underpaid though? I mean, his salary, it's only $41 million a year.
That is kind of light, isn't it?
Do you think that is abuse?
I do. That guy should protest somewhere.
So succinctly, why do you not do Invisalign?
I don't do Invisalign because I believe that I am a better orthodontist than the computer technicians at Invisalign.
Nice. Okay, so let's go to the monitors. I loved your quote on it's called Orchestrate. Orchestrate 3D. You said yours truly says, I love the ability it gives me to control everything in the aligner process. I have been using Orchestrate 3D software and their in-office printer since 2014. Their systems allow me to do all my retainers and aligners in the office. The retainers and aligners we produce are always dead on, accurate, and fast. And Dr. Todd and their service team are second to none, blah, blah. So are you using your own software and printer? Do you think it's more so that you can get it back faster time? Is it more because it's lower cost? Is it more because you're more in control and you're designing and doing it? What's most weighted and least weighted in that?
I think control is the highest weighted factor. So if you've ever done an Invisalign case, you are familiar with the term revision. And that's because that's inherent in the software if you don't control it. I don't ever do revisions because you're using it's just another tool. It's just like bending a wire or deciding where to place a bracket. I don't do revisions.
Okay, I don't think a lot of kids know what a revision is.
Okay, sorry. So what happens is if you send to a software company and you have them make your aligners, they're going to say this case can be treated in 22 aligners and you can change them every 2 weeks. And so you have a conversation with the patient that says, hey, guess what? We got this case back and it says we can treat it in 22 aligners. They change every 2 weeks. So this is a 44 week case. So I'm going to give you, 5 or 6 aligners at a time. We're going to check progress. But when we get to this number 22, everybody has the same expectation that we're going to be done. Well, you get to 22, and because of the inherent properties of thermoplastic materials, there is some slop in that system. And so when that slop is magnified by 22 trays, you're not done at tray 22. And so what you do is you rescan that patient, you send it back to Invisalign, and you do a revision. And those revisions can be 14 or 15 trays. I mean, they can be a lot of trays because you're catching up for the slop in the system. So what it does is it makes you feel like an idiot. Unless you've explained that to the patient before, the patient is disappointed because they thought they were going to be done at tray 22 and now they've got 14 more trays. So there's just a lot of conversations that need to be had. That's what a revision is. So when you understand the principles of thermoplastic materials and how to correct for the weaknesses of that material, you can avoid doing revisions. And so you can finish when you tell your patient that you're going to finish. So the control is my favorite part, but it's significantly less expensive. What was the third option I had? You said there were three things. I can't remember the third one.
So you like Orchestrate, and that's by another orthodontist. That's Todd Erler, right?
Yep.
So tell me what Todd Erler is doing, and why do you like Orchestrate and Todd Erler's company?
So Orchestrate is a software that takes a scan and creates an individual file for each tooth within that scan. Okay, so if you just take a scan and you want to make a retainer, you can go straight from a scanner to your printer and print that model. But if you want to move the teeth, you have to be able to make each of those teeth an individual file so that you can move them. So this software, Orchestrate 3D. The other one I use is called ULab. If somebody wants to look up ULab, those are the two softwares that I use right now. Both of them do this. So they generate a 3D object for each tooth that has a gyroscope in it that allows you to move that tooth in 6 different planes. And so you can take those teeth and move them individually to where they need to be. And then the computer will measure how far that tooth has moved in all of those dimensions. So it'll tell you this tooth moved, 1 millimeter distal and torqued 17 millimeters and rotated 22 millimeters, whatever measurements you've done to it. And then you get to decide as the orthodontist how many trays it's going to take to get that tooth to move those 33 degrees or whatever the millimetric difference is. And so that's what I meant earlier when I was talking about the differences between these software programs. So Invisalign might take that movement and their software is going to say this is going to take 22 trays. Smile Direct Club software might say this is going to take 28 trays. You might look at it and say this is going to take 12 trays. Whatever the number is based on your experience. And that experience is based on, with companies like Invisalign or Smile Direct Club, they're taking an kind of a industry average of what those movements should be and just putting them on those teeth. So if you've ever moved teeth in real life, even with aligners, but with braces, you know that different teeth have different root structures. They move differently. It's different movements are harder for different teeth. And so if you're controlling that with an Orchestrate 3D or a ULab, you get to decide which teeth are going to move when, which direction, how are they going to get out of the way of each other. All of those decisions you make because you're an orthodontist. So the end goal, like if you look at an Invisalign, the cartoon of what it's going to look like, those teeth are going to look straight and aligned. If you look at an Orchestrate case that I've done, at the end, those teeth are going to look straight and aligned. The difference is how we got there. And that's what determines how efficient the system is.
So you mentioned ULab.
Yeah.
You mentioned ULab, and they're in the news because they orthodontic aligner software ULab Systems announces partnership with Bay Materials, the maker of Zendura clear aligners and retainer materials. What did you think of that announcement when you found out that ULab is partnering with Bay Materials, the maker of Zendura clear aligners? What does that mean to you?
I don't know exactly what that means. I'm wondering if they're going to start printing trays for their customers. So I use them only as to generate STL models so that I can print them. But there may be other functions within that program that I don't use that allow you to send that STL file to them if you don't have a printer, and maybe they'll print it and give you Zendura aligners. I'm not sure what that partnership.
Do you know the ULab founders, Charlie Wynn and Amir Abofay?
I have met them.
Are they orthodontists or?
No, they're software guys.
Okay, they're software guys.
Yep.
So this is mostly a software planning company.
Yes.
For the scanning.
Yep. They also have a really cool thing that they haven't brought to market yet, but I've seen at some of the trade shows where they have a machine that will trim. So all of these models right now are all made by vacuum forming. So you take the Zender and you vacuum form it over your 3D printed model. Well, then somebody has to cut that and get rid of the excess and polish it up and turn it into a retainer that somebody can put in their mouth. And ULab has a product that will set that model on a tray, and they have a little laser that goes around and cuts your tray for you so that you don't have to do that. And I know that's coming, but that's pretty cool.
I love Charlie. I love his LinkedIn page. Founder, no more updates. God brought me to this world to give me a brain to invent stuff to benefit people. I'm never afraid to try in various industries. Nothing satisfies me more than to make people give big smile.
There you go.
But the reason I was asking is about these two guys is, do you see, whichever base you're on, I don't know if you're on first base, running to second or third, is the next big thing in your profession is AI, combining AI? I mean, you're digitally scanning, you're digitally printing. Do you think these guys are looking at something AI based where?
So there is some AI actually in the ULab software. So the ULab software learns. So I don't know if you've ever done attachments, but somebody in your audience is going to have done it. And
okay, explain to them what that means. So okay. Clear aligner versus attachment. Remember, they're still in dental kindergarten.
All right. So when especially if you use Invisalign, there will be attachments, which are little composite squares, triangles, pyramids, half circles. There will be a little composite bump on the teeth that the aligner can grab onto. And the reason that those attachments are there is because the aligners are inherently sloppy, especially after aligner 12 or 13, but the attachments never change. The teeth can move, but the attachments never change. And so the attachment gives that aligner and the software engineer something that they can depend on. So that's what an attachment is. So for example, I don't use very many attachments because of the way I design my cases. And the software in ULab, for your first case, it's going to assume that you're coming from an Invisalign type background. So you'll bring a case up and tell it kind of where you want to move these teeth, and it will automatically generate attachments that it has been programmed to put for certain movements of teeth. And so you'll get attachments on different places all over the teeth. And then you have the option to take those attachments off. And so the first time you do that, you take a bunch of attachments off. And the next time you get a case, it puts up maybe 3/4 of the number of attachments. Like it's still saying, hey, guess what? Our software says you're supposed to have an attachment if you do this movement. And you delete that attachment. And after a couple of times of doing that, and I don't know the number, but it starts to learn, oh, Kenworthy doesn't like attachments. So now when I do my cases, it doesn't give me any attachments. Any attachment that I put on there, I have to place on the tooth. Because so there's some AI built into that software, which is kind of fun to watch. And it's based on my user profile. So if you went on and said, I'm going to do a ULab case, it knows that you're not Christian Kenworthy, and so it's going to throw a bunch of attachments at you because it's going to assume you're coming from that background. And until you tell it, I don't want attachments, it's going to keep putting them on because that's what it's programmed to do.
So do you think with artificial intelligence that, with big data, that the more, like if you send in your first impression, they don't really know who Ken is, but after you send in 10, they know you more. But at 100, they scale you more. At 1,000, do you think it's one of those deals where if you keep going digital, big data, AI, that the quality goes up as the data set gets bigger?
I think that your average quality, yes, will go up. The problem is nobody's really average, right? And so because orthodontics is so custom, using that average, I think, is great to get started. But what I like about both ULab and Orchestrate has an AI function too, where it'll tell you the number of trays it thinks you should use, and it can do an auto alignment thing. Those are great. They're great to show to patients. So I use these technologies in my new patient exam. So every patient that comes to see me is scanned before I see them as a new patient. And their STL map is on my computer when I sit down to talk with them. So I can move teeth while we're talking to them and give them an idea of what we're trying to do with our orthodontics. So those things are all great. The reality is we're all custom, we're all individuals. And so there needs to be some modifications. And both of these programs, Orchestrate and ULab, allow the user to tweak it. So you can say, give me your best shot, and it'll kind of give you an alignment, and then you can tweak it and make it right, or do the overcorrections that need to be done to compensate for the vacuform material, which is really cool because it allows you to use the AI and still make it perfect.
I asked my girlfriend if I was the only one she'd ever been with, and she replied, yes, the rest were all 9s and 10s. Said nobody's average. That was an average joke. The one thing our listeners don't like is when people don't pick one or the other. You like 2 in-office aligners. You like Orchestrate, and you like
ULab.
Bay Materials Makers Endure with partnership with ULab. Because they're cynical. They know a lot of people are selling stuff, so they're always going to say, well, if you could only buy one, which one would you buy? So narrow that 2 to 1.
So you're talking about orthodontic movement software is what you're asking me right now. And those softwares are different. It is simpler to use ULab for someone who is just starting out. It's faster to get from scan to model. The pricing structure of ULab is based on the number of STL files you generate. And so right now I'm probably spending $500 to $600 a month on ULab. Orchestrate is a software program that you buy, and then it is yours. So it's free to use until you decide to update it. And then updates cost whatever they cost, depending on the upgrade amount. So for someone who is starting out, I would say, so Orchestrate has partnered with Park Dental. And so Orchestrate will sell you the software, the computer necessary to run it, and a printer. So you can be, besides a scanner, you can be ready to print your own models with that Orchestrate software when you buy it. You have every piece. The ULab is just the software. And so you still have to buy a printer from someone else and have that person come set your printer up and calibrate it. And so those two things have to talk to each other, and having them in one company, having Orchestrate be your software person and your printer person, if there's ever a problem, you just call Orchestrate. Because sometimes you don't know where the problem is. Did this not print right because my printer is wonky, or I didn't set it up right, or did this not print right because I did something wrong in the software? And as you know, as everybody knows, there's nothing more frustrating than calling a service company and saying, hey, I'm having this problem. And they say, oh, it's not our problem. That's the printer. You need to call the other guys. And you call the printer and they say, well, we checked the printer out. It looks good. You need to talk to your software company. And you want to just say, here, you talk to this guy and figure it out. And so the benefit of using Orchestrate is it's an all-in-one package. And so there is nobody else to call. They just make it work. And they do a great job of making it work.
Okay, so then would you call that, when they work real well together, is that an open system or a closed system?
So it is still open. So like I use ULab and I still print it on the printer that Orchestrate set up for me, okay? But somebody had to come set that printer up. And I've actually, all of my printers I bought through Orchestrate. And Orchestrate kind of beefs the printers up a little bit. They make sure they're ready to get calibrated. They make sure that all the parts are beefed up because they know orthodontists are going to use them 10,000 times a year. And so, but it is still an open system. Orchestrate does not care where you get the scan from, and they don't care what printer you go to. So you could just buy the Orchestrate. If you already had a printer, you could buy the Orchestrate software and send it to that printer. If you already have a printer, or if you already have the ULab software, ULab doesn't care what printer you're using either. So all of these are open system. The only the only nice thing about the Orchestrate is because they've sold and delivered you the printer and the software, there is no, when something doesn't work, you just call one place.
And are you calling them a lot? I mean, even let's just laugh. The office printer. Most people will not buy an office printer because it breaks down so much. They'd rather just get a maintenance plan.
Yeah.
I mean, printers just notoriously don't work.
Yeah, no, it's just when they're getting set up. There's a bunch of moving pieces. And so the learning curve is about this steep. Once you get there, it is beautiful. But that learning curve is really steep. And so trying to put all those pieces together yourself is going to be a 2-weekend project where you're spending 18 hours a weekend at the office making sure that, you know, when you tell a tooth to print that's 7.6 millimeters wide, then that's what it says on your computer. When you print that tooth and you measure it with your caliper, it's really 7.6 millimeters wide. And so those things are things, and so it's really just at the beginning. After that, the printers just run. We had to update one of our computers on one of our Joule printers about 3 weeks ago because everything's going to Windows 10. You know, they're not supporting the Windows 7, and so we had to change a computer out on it, and that was all done over the phone. So we just called the guys down at Park Dental, and they walked through over the phone with us how to get the new computer hooked up with the printer, and you had to work through a couple bugs because that had to get recalibrated. So it took a day. Our printer was down for about a day, running some tests, and then it's been back up.
Yeah. So in all honesty, if let's just say that you made an online CE course for Dentaltown on how you do all this. Yeah. What would the orthodontist on Orthotown, because Orthotown, you can't join Orthotown unless you're an orthodontist. I mean, I own the site. I can't go on it. I own the magazine. I've never had an article in it, and that's cool. I mean, I remember in Arizona, it had an all-boys golf course for years, and I knew like 5 dentists that were members there. And there was so many people outraged by that, and it's like, freedom, man. If you're 5 guys and you want to have what was it called on the Little Rascals, the... Remember?
The all boy woman haters club.
Yeah, the all boy, whatever. So it's totally cool. In fact, the biggest, fastest growing thing on Dentaltown is private groups where you can set up your own private group and but you're the one that can let people in or out and no one else can see what's doing. Because the problem with Facebook so much is there's no anonymity. You can't go ask a stupid question on Facebook when everybody sees your profile. But anyway, is there still kind of bad blood on that, where if you were showing general dentists how to do that on an online course on Dentaltown, would some of your specialists look at you like you were a traitor or something like that, or is it not like that?
So maybe, like, the problem is, how are you going to teach? You're basically, so teaching someone how to print models and make suck down retainers, I think, is general knowledge. The part that would be hard or weird to teach is how to know how to move the teeth in a computer system. Because that's like all of your experience from your ortho residency and practice in orthodontics. So generally, I don't teach that part really, even when I lecture, because that is just orthodontics. What I'm teaching is I teach orthodontists how to apply the stuff they already know to this digital world. And so, teaching somebody or explaining to someone, hey, this is a good printer and this is how you hook it up and this is why you'd use it, is easy. But like you'd have to do an orthodontic residency to teach people this is how you move this tooth, because you're doing it because you need the root to follow and all that kind of, you know what I'm saying?
Yeah, this is Dentistry Uncensored, so I don't want to talk about anything that everybody agrees on. I like to talk about all the stuff that makes everybody mad, and I'm just going on my 32 years experience just in my back door. There's also turf feuds between, there are open bashing of a pediatric dentists who do the class 1 interventions.
Yeah, those guys are punks.
Yeah, so talk about that. What do you? So talk to those young pediatric dentists. What is the macroeconomic debate between pediatric dentists and orthodontists?
So I think the same way I was telling you about dentists who do Invisalign. And I know there's a lot of orthodontists that just ruffles their feathers. It just pisses them off.
What pisses them off? The general dentist doing Invisalign?
Yeah. And the same thing will happen with pedodontists doing orthodontics. So pedodontists that see a case in a crossbite and they put an RME in.
An army?
An RME, a rapid maxillary expander.
Okay.
If they're putting something in that is like a phase 1, we're just trying to get the bite right, or we need to take a tooth out here, or we're going to put an expander or whatever. I think those guys are doing a great service to their patients and to the orthodontists. The times when pediatric dentists get in trouble are when they do that, and then they say, well, heck, this guy's already my patient. I'm going to do braces on him too, when they haven't been trained to do braces. It's the same thing as, it's not as bad as Smile Direct Club because they're at least a dentist. I mean, they understand gum health and they've looked at an x-ray. But, I mean, I haven't done an endo for 20 years. I graduated in 1997. So it's been longer than 20 years. If I said, hey, this kid's developing pulpitis, he doesn't need to go to his general dentist, I'm just going to do this endo, it would suck for the kid because I'm not good at doing endos. And so that's where I think it's a problem. I understand the economic argument for a pedodontist to do orthodontics, but I still think, maybe I'm old school, I still think having the right guy do the job is still the right thing to do.
So succinctly summarize that again with a pediatrician. You don't care if they do a rapid palatal expander, they're in there at 6 or 7, they see a crossbite, they do that. That's not the issue. The issue for you is more at 12, 13, 14 coming in for final braces.
Right. If they're, because it's easy, if you've got one appliance and it's a rapid maxillary expander and you've got one appliance for a lower arch, which is an E-arch, and those are the two hammers that you have in your toolbox and you can see where that hammer is needed, then do it. But what the problem becomes when you start saying, well, braces are easy because I did this rapid maxillary expansion, it worked out super well, I'm going to do the braces next, and you start doing everything, you just end up, as long as you're not doing crappy work, do it. If you've been trained to do it and you feel confident, then do it. But don't do it just for money. That's how I would sum it up.
Speaking of that, when you said that when someone has a pulpitis, you're not going to do the endo, you're going to send them to someone else to do it. It's kind of maybe instantly think of orthodontist Ben Burris, who got in all kinds of controversy because he decided he was going to have hygienists start doing cleanings. Yeah. And he was the most, we've had him on the show. He was the most controversy guy that I've ever had on the show for orthodontist. And now that he's indicted him for fraud, did you hear about that? And what were your thoughts on that?
I didn't know. I never really knew Ben Burris. I guess he was too fringe for me. So I never went to the meetings that he was running. I was interested to follow what he was doing. And I think an orthodontist having a hygienist doesn't hurt anybody. It just helps the patients.
Man, that was like, it probably been easier if he just started selling drugs out of his office. I mean, I go to Arkansas because my sister Kelly lives in Fort Smith, and my God, I first asked, does he have hygienists like drinking beer while they're doing, what is the deal? But it was just an explosion. What do you think why do you think everybody was so upset that he had hygienists cleaning people's teeth?
I think they were upset because of the same reason that most people perceive that orthodontists are upset about pediatric dentists taking their money. Like hygiene in your office, how many chairs do you have that are dentist chairs versus how many chairs you have that are hygiene chairs?
2 hygiene, 6 dentists.
Okay. So you're running hygiene chairs a lot, right? I mean, hygiene is a part of your practice. It's a part of your income that you count on. So I, as an orthodontist, the guys that refer to me are all my buddies. I ski with them, I hike with them, we surf with them. We have birthday parties with them. Like, I don't want to take the money away from their practice. And that's why I wouldn't do hygiene. But I think that's the same reason that everybody got pissed at Burris, because that's if you're a dentist that has 3 hygiene chairs, you're a solo practitioner, you got 3 hygiene chairs and 1 or 2 dentist chairs, those hygiene chairs are going all the time. And some of those cases of hygiene are orthodontic cases. They're kids with braces on. And so those kids with braces, you don't see them for 3 years. That's that much money, that much income that hasn't come to your practice, because a hygienist working in an orthodontist office or a hygienist working in a dental office isn't doing any worse hygiene. It's just an economic question.
By the way, the most controversial thing you've said so far on your show was actually when you slipped and called, you called them pediatric dentists 3 times, but you called them pedodontists once. Oh my God.
Oh,
That's a good way to get smacked. They, pedo. They just don't want to, they don't want to be associated with pedos.
You can edit later, right? You can
I'm not going to edit. I think it's hilarious. I didn't even know there was such thing as a pediatric dentist until I was older. But, so, my professor used to always say to me, he says, I don't care if your work is average or below average. I just want you to get an A on the diagnosis and treatment plan. I'd rather you get an A on the diagnosis and treatment plan and a C on the work than get the wrong diagnosis and treatment plan and then get an A+ on the work. And so what does that make you? It makes me cringe a little bit when I see these weekend courses for anesthesiology. I mean, anesthesiology, that's years in a hospital where people can die. That's not something you learn at the Holiday Inn. And the same thing, there's a lot of short-term orthos, 6-month ortho, and I'm like, it's not, and I'm always sitting there thinking, God, I wouldn't want an anesthesiologist touching me unless that's the only thing that guy's done. And dentistry, I'm always been able to call crap on my own tribe. I mean, I'm politically incorrect because I'm honest. And you can't go in any hospital in Montana or Arizona and do the anesthesia and do the surgery. It's against the law. It's a specialty. And when I see these malpractice claims, when they get to six figures, somebody died and it wasn't from choking on a cotton roll. So I've never done it. I mean, and so the same thing when I see like 6-month smiles or things like that, it's like, my gosh, I'd rather you just take ortho courses and learn to diagnose and treatment plan and never do a case.
Yeah.
But it's kind of the opposite. It's like, well, let's let's just kind of show you some tricks to jump in and so what do you agree with that? I mean, do you remember how the phrase went? Did your professor say that? I'd rather get an A on the diagnosis treatment plan and a D on the work than a D on the treatment plan and an A on the work. Did you ever hear that?
I think that's 100% correct. And that is the major problem. I mean, most, if not all, of the orthodontic malpractice suits that I've seen have been by pediatric dentists, most of them, but it's because they treatment planned it wrong. Like, you can't get to the right answer if you're not going the right direction, and especially in ortho. I mean, ortho is long-term, right? We're talking about 18 months, sometimes 24 months. Sometimes if you really treatment plan it wrong, that can be 4 or 5 years. And so the time between when you put the braces on and when you realize that your treatment plan was wrong can be a long time if you're not familiar with doing it all the time, right? And that's where people get in trouble, is it's thinking that you're flying to Hawaii from San Francisco and you look down at the map and you see that Tahiti's in front of you instead of Hawaii. That's a lot of gas you burned going the wrong way. And that's where guys get in trouble. So I agree with you 100%, which is also comes back to the same problem with the Smile Direct Club. The treatment plan is based on some guy sitting at a computer looking at alginate taken by a person that's not even a dental assistant. If you got a crappy alginate taken at your office, you're not going to build a crown off of that. You're going to tell somebody to retake the alginate. How long does it take you to train an assistant to take a good alginate or a good polyvinyl siloxane impression? Like, that's a skill. It's not something you can send in a box and say, just stick your teeth in this and we're going to make aligners out of it. So you get these crappy trays, you stick it in a software program. I'm pretty sure they have dentists working the software program. But you got some guy working a software program who's never talked to the patient. They might get an email chief complaint or something. And they say, this is what I think your teeth should look like. What do you think? And the patient says, well, they look way better. You know, your snaggletooth case that you showed at the beginning. Yeah, I just want my snaggletooth fixed. Well, I can fix your snaggletooth. Here we go. And they run with it. So it's crappy treatment plans lead to crappy work. Even if it's an A+ amalgam, if it's on the wrong tooth, you still did the wrong thing.
But you said that most of the malpractice cases you say were actually from pediatric dentists.
The ones that I've seen, yeah. I mean, I've had people whine about cases from orthodontists, but it isn't because something was done wrong. It's because the patient was unhappy. The ones in my specific area that I have seen that have been incorrectly treated have been from pediatric dentists, and that's just my experience here.
Okay.
I'm not trying to start a fight. I know you're trying to get me to start a fight, you little punk.
Well, you know what I think dentists do is when they're in front of each other, all the smiles and all that stuff, kind of, yeah. we want to get along, and then and that's why they like. The reason Dental Town survived Facebook is because they can be anonymous and ask a dumb question. No one wants to go out there and say, you know, it's like when I'm on Instagram, you know, it's like your prettiest picture. But right. on Dental Town, it's like, okay, I woke up, this is bad. And they can ask dumb questions and that they won't ask in public. Like they always want to know. So I'm going to ask you some more controversial ones. Does orthodontics, is that a treatment for TMJ? Some people swear it is. Some people say it isn't. When someone has TMJ, a lot of them, so this is what they tell me. They get out of school, they become a dentist because their mom is, they go back and practice their mom, and their mom's telling them all this stuff like, well, we got to get these wisdom teeth out now because to see how they're impacted, and they're growing forward, and they're gonna make all this anterior stuff crowded, and she's sitting there looking at something from, you know, the NIH, and she's like, okay, mom's from Parsons, Kansas, and the NIH, this isn't true. And another thing mom's always saying to her daughter, to the patient is that, well, you know, all the joints, when I straighten my arm, my elbow determines where my hand is. But when I close this joint, it has to fit the teeth. So you got TMJ because the teeth isn't lined up with the joint. And so they're asking me, did my school not get it right? Or so succinctly, is orthodontic treatment a good idea to solve TMJ cases? And by the way, when you write into me and say it's not TMJ, it's TMD, oh, shut up. The patient calls it TMD, and I'm talking to the patient. And for the endodontist to try to change endodontic root canals to endodontic therapy is laughable. But anyway, is it a treatment option?
So I think in some cases it is. So in my practice, if somebody comes in with TMJ, so they've got hot joints, first I'm going to look at the cone beam of their joints and make sure that the bony structure is correct. The second thing is, before I diagnose whether their teeth are even involved in that, is I usually send them, there's a physical therapist in Missoula who's done some specialty training in jaw joints, and I send them to her and let her see if she can get them comfortable. The third thing I do is I take their teeth out of the equation to see if the jaw joint pain still persists. Because mainly I don't want to get burned. I don't want to say, okay, we can help you, and then not help them. And so I will give them, I'll make them a little suck down, we'll print them a suck down, and I'll put some little bumps on that suck down so that they have no interferences anywhere, basically give them fake teeth and tell them to wear that for a couple weeks. If the problem goes away, and this is not like, I'm not trying to do anterior with guidance, or I need this, or I need to post, I'm not doing gilbs, I'm just separating the teeth. It's an appliance that takes 5 minutes to make, and it just makes sure that and what I tell them this, I want to make sure that your teeth affect this. And so we're going to pull your teeth apart from each other so they can't hit, and you're going to wear that for 2 weeks. And they come back in 2 weeks, and if they say, yeah, my jaw joints still hurt, then I tell them orthodontics is not a solution for you, because all I can do is move your teeth. And so I think there are some cases with cross bites or anterior scissor bites or something like that, really deep bites, where you can affect how free the jaws are to move, that you could have an argument that said, we might be able to help you with your jaw joints. But I think that if orthodontics is a solution for TMJ, then so is full mouth reconstruction. And I think we would all agree, probably, that if somebody came in and they had a sore jaw joint or a jaw joint that made noise when they opened too wide, that full mouth reconstruction probably isn't the answer. So the other way I use to determine that is I ask people, does your jaw joint hurt when your teeth are together and make noise, or does it make noise when your jaw's all the way open? And if they say, it hurts when I do this, and their mouth's open as wide as they can go, then I say, well, then it really doesn't matter where your teeth are. So orthodontics probably isn't the solution if it doesn't hurt when your teeth are touching. So I think your answer has to be qualified.
Okay. So, can I ask you a couple more overtime questions? I know we went over an hour.
Oh, I haven't been watching. This has been fun.
One of the biggest controversies of your profession is with the oral radiologists who do not like the use of a CBCT. They just think it's too much radiation. They're saying that the use of a thyroid collar is non-existent. So my succinct question to you is CBCT the standard of care in orthodontic radiology? Is this moving forward going to be necessary as we go into a digital world with big data, the Internet of Things, and Python programming? Or what are your thoughts on CBCT?
I think that CBCT should be the orthodontic standard. Like I have used it for 4 or 5 years. I have a plan Mecca that gives 21 microsieverts of radiation, which is nothing. Not nothing, but very minimal, and less than what I was giving before with my old Pano machine. So my CBCT gives less radiation than my pan machine. So I use it just like a pan, except there's a lot of things that are better. Being able to see impacted teeth and bone, amounts of bone in 3 dimensions is way better. The other thing is CBCT does not have a magnification factor. So I can send you a copy of my CBCT and you can say, oh, this is 7.5 millimeters. That's enough room for me to place the implant. If I send you a Pano, you don't know how far my Pano film was from the head. You can't take a measurement off a Pano. You can only see relative facts. So I think that, especially in my case, CBCT is less radiation and probably orders of magnitude improved diagnosis. So if you're going to tell me, like, I agree, but if we're going to agree that diagnosis and treatment planning is the most important part, then we have to agree that cone beam is the standard of orthodontic treatment.
But is a CBC necessary for a routine screening? Like the mom just says, well, my 6-year-old need braces. Does that automatically mean CBCT?
In my office, it does, because how am I going to know where those?
Do you use a thyroid collar?
My whatever it's called, the little cape thing, does have a thyroid collar on it. But otherwise, in the past, I would have used a Pano. I'm not going to help her diagnose without a Pano, and the Pano was more radiation than the CBCT. So in my office, it's not a question. And the radiologist kids who I've treated, I've asked them this. I've said, I know the ALARA principle, and how do we make sure that we're not, like, sometimes I need to monitor an impacted tooth. Is 6 months too short? Is 9 months too short? Is a year too short? And to a person, the radiologists who I'm treating, whose children I'm treating, have told me, you take this image, you take whenever you need it. There is not enough radiation scare in this machine to make me even question whether you need an image or not.
Well, young kids see a phenomenally successful guy like you. I mean, you're all that and a bag of chips, and they're like, are all these, there's so many companies that sell brackets and well, first of all, what % of your practice is clear aligner versus brackets and wire?
Clear aligner might be 30%.
So it's only a third, 30%.
I would say probably close to that.
And all the surveys that we've done, as owners of OrthoTown and everything, it seems like 20% is like the average, but it gets like 100% of all the press. It's kind of like when you go to a dental study club, it's like, or dental meetings, they always have the all on 4 lectures, And everybody listening, it only does all on none. It's like, okay, I've done 6 all on none dentures, but all the courses, none are on that. I mean, who would have a denture on an all on none? It's not sexy enough. But, or brackets, or do you think these different, first of all, how many different bracket systems do you think there are?
100 maybe, 50.
And how many do you need to see all your patients?
One. So, yeah.
And what exactly is that one? They always want to know, what do you use? What is your bracket?
I use Clarity flash-free brackets from 3M. So they're all porcelain. So every solution in my office is invisible. But the reason I chose that bracket is because there's no flash. So the 3M people have figured out a way to make a bracket that's pre-coated with glue that when you push onto the tooth, it doesn't make any flash around the bracket. So there's no cleanup and there's no risk of flash that can collect bacteria. So the reason I use them is not only are they're a beautiful bracket, they're clear, but there is no flash, and so it's faster to put them on. Remember, I'm an efficiency guy, so that it's one less step to put them on, and my risk of decalcification and caries around the brackets is less. So that's what I use. And that's all.
And so that's what?
I said that's the only facial bracket that I use. I use what's called incognito, which is a lingual bracket. So you can get clear facial brackets, you can get lingual brackets, or you can get aligners at my office.
You also, I swear this is the last question. It's the last of the last questions. You also talk a lot about custom bonding jigs and the surf technique. What my homies don't know what either of those are. What is custom bonding jigs and the surf technique?
So custom bonding jigs are, I will scan a patient before we start braces and put that into my software, either that Orchestrate, and usually for jigs, I'm using Orchestrate pretty exclusively. I will line the teeth up, so I'll correct any occlusal cants, I'll correct everything, and then I will place digital brackets in that setup. And then I will print that model with digital brackets on the model. And then I'll make a suck down tray with and so before I print that model, sorry, I skipped a step. Before I print that model, I let the malocclusion return. So I just tell the computer, never mind about the fix that I did, go back to where the teeth were crooked. And so the teeth will go back to where they are in the patient right now, but the brackets that I placed when the teeth were straight are still in the same position. So it's told me where to put the brackets if I want to not put any bends in my wire. And then I print that model, I make a suck down tray, and we cut the little window out where the brackets would be. You place that on their teeth like you would an aligner tray or any other kind of retainer, and there's a hole in the model where the bracket goes. So the other reason I use flash-free brackets is because otherwise the brackets would stick to the jig material. And so you just put those brackets where the hole is in that retainer, and because you've already done the setup, you can let the nickel titanium technology bring those teeth to where they're supposed to be without thinking about it. So it allows the teeth align quicker, but you also don't have to see the patients as often. So I can go 12 or 16 weeks between visits because I know the brackets are in the right place. As long as the patient doesn't break a bracket off, those teeth are going to end up where I want them to go. So surf technology is something that I teach, something that I've invented. That stands for Setup for Rapid Finish. And that's where I use this jig. So it's just like you said, it's all about the treatment planning and the diagnosis. So we diagnose and treatment plan that case, build a digital finish. So before they get their brackets put on, we've already finished their case. We know where it's going to end up.
So surf is set up for rapid finish.
Yep.
And finishing is the whole game. Do you think finishing? Do you think it's diagnosing, finishing, or retention?
The retention has way too many variables. You can't control retention. And so I think your diagnosis and your finishing set up your retention. But what it allows us to do, you say to me, so let's say a patient comes in and, like all patients, they don't want to wear braces for very long. Some of those patients will think, I only want aligners. Well, some cases can't be treated with aligners. And so we'll use this surf technique where we'll set them up in the computer where we know they're going to end. We build brackets to that position. We put those brackets on and we let them cook. And for an adult, like let's say you're getting married next summer and you come to me now, which always happens in orthodontics. They think, oh yeah, I'm getting married next summer. I want to have straight teeth. And they come see you in October. And you think to yourself, there's no way in heck I can get you done by next June. And the truth is you can get them to a position where you can finish them in aligners really easily. And so surf technique does this bracket bonding jig that gets the teeth in the right place. We work through wires for about 6 months, and then we take the braces off and build aligners to finish. So we do the finishing in that specific case, we would do the finishing in aligners after we've got all the kind of heavy lifting done with the braces. But it's all set up from the first day.
Well, I mean, I was so excited to have you on the show. I loved your article in Ortho Town. When I Googled your name, I mean, you are a rock star. I know you're a humble guy in Montana and all that stuff, but you are a rock star. And it was just an honor that after a really long, hard day, you decided to instead of hang out with your 5 boys and eat cupcakes to come on Dentistry Uncensored and talk to my homies. And I just really deeply appreciate it. Thank you so much for coming on the show today.
You are welcome. Thanks for having me. This was really fun.